So we're doing the ECG and the conducting system of the heart. Where is the SA node located? SA node is located in the upper posterior wall of the right atrium below the opening of the superior vena cava. And where is AV node located? AV node is located at the interatrial septum. From the SA node, the impulse goes to 2 points. Number one, it directly stimulates the atria, and number two, the impulse goes from SA node to the AV node, and from the AV node to the bundle of his to the ventricles. The AV node is the only connection between the atria and a ventricle for the conduction of the impulse. So this is the SA node, AV node, bundle of his dividing into two right and left bundles. Where is anterior fasciculus and posterior fasciculus of the connecting system? The anterior and posterior fasciculus, they both arise from the left bundle. See here, this is the left bundle, this is the right, is the left posterior fasciculus and the anterior fasciculus arising from the left bundle. How the AV node is connected to the SA node? There are three internodal pathways that connects the SA node to the AV node. The anterior Bachmann, middle Wenckebach's and posterior Thorel. SA node and three connections between the SA node and the AV node. The anterior Bachmann, Wenckebach's and posterior Thorel. What is the nerve supply to the SA node? It is supplied by the sympathetic nerves are from T1 to T4, and the parasympathetic supply for the SA node is from the right vagus, and for the AV node is from the left vagus. Why? Because the right SA node develops from the right side of the body and the AV node develops from the left side of the body. How does the vagus is inhibitory? How is the vagus inhibitory to the heart? It increases the potassium conductance and decreases the calcium permeability. That is why it's inhibitory to the heart, slows down the heart. What is the resting membrane potential in the heart? It's minus 80 millivolt. So where is the action potential of the cardiac muscles? Where is the plateau? What is the plateau in the action potential? Plateau is the phase 2. And what happens in phase 2? The calcium channels open and the potassium channel close. So calcium enters in. Where is the sodium enters? In which phase? It is the phase 0, where there is a rapid entry of sodium, and phase 1 is a sodium channel close. Phase 3, when the calcium channel close and a potassium channel open, and phase 4, potassium channel open, and this is the phase of repolarization. So the resting membrane, what is the resting membrane potential is minus 80, and when it depolarizes, it goes up to plus 20 millivolts. And how about the action potential in the SA node? In SA node, action potential, there is no plateau, and it's a monophasic action potential. The phase 4 is a slow sodium inflow or influx, and then in phase 0 there is a calcium influx, and in phase 3 there is a fast potassium outflow. So this is how it's different from the cardiac cell action potential. And what is the difference between the conducting tissue and the myocyte? The conducting system is rich in glycogen and sarcoplasm. So how does the digoxin depresses the AV node? Digoxin depresses the AV node by acting like the vagus nerve. It increases the potassium entry and decreases the calcium in the internodal tissues. This is how it decreases the rate. So how the sympathetic nervous system acts? It releases the noradrenaline that act to decrease potassium and increase the calcium permeability via the beta receptor. What is the relationship of temperature with the heart rate? 1 degree increase in temperature increases the heartbeat by 10. What happens to the impulse in the AV node? The impulse in the AV node delays. How long it delays? It delays for 0.1 second. And what's the speed of conduction in the AV node? It's 0.05 millimeters per second. So where in the conducting system the speed of conduction is slowest? That is the AV node where the speed of conduction is slowest is 0.05 meter per second. Where in the conducting system the speed of conduction fastest? The speed of conduction is fastest in the Purkinje tissue and it is 4 meter per second. So there is a difference of speed in the AV node and Purkinje tissue of about 80. How does the impulse is spread? It is spread from endocardial to the epicardial surface. What is the first part to be depolarized? It is the left side of the interventricular septum and then the apex. And what is the last part to be depolarized? The last part to be depolarized is base of the left ventricle and upper part of the septum. Why the impulse delays at the AV node? What is the purpose of the delay? The impulse delays at the AV node because the size of the node is small, and number two, there are fewer gap junctions that delays the impulse. And why does it delay? The delay is to perform the ventricular filling. Ventricular filling completes because of that delay at the AV node. Okay, now the atrial and ventricular depolarization and repolarization, how long it takes. What is PR interval? PR interval is atrial depolarization and conduction through the AV node. And how long does it last? It's about 0.12 seconds to 0.2 seconds. What is QRS? QRS is ventricular depolarization, and how long it lasts? It lasts for 0.1 second. QRS. And what is ventricular repolarization? Ventricular repolarization is ST or QT minus QRS is ST or ventricular repolarization and is about 0.32 second. If you add up to both of these, ventricular depolarization and repolarization, the duration is total duration of depolarization and repolarization is 0.43 seconds. What is the U wave in the ECG? The U wave is due to the papillary muscle repolarization. Now the chamber positions. Atria are present posteriorly, whereas the ventricle are anteriorly. How the base is formed by the ventricle. How apex is formed by the left ventricle. how the lateral anterolateral surface is formed by the right ventricle. What is oculocardiac reflex? Massage over the eyeball decreases the heart rate. Why? It is due to the stimulation of the vagus nerve, the 10th cranial nerve, the parasympathetic nerve, which is stimulated, decreases the heart rate. So this converts, oculocardiac reflex converts atrial tachycardia and flutter to a normal rhythm. But this increases the block in digitalis toxicity. So oculocardiac reflex is beneficial for the atrial tachycardia and flutter, but dangerous in case of digitalis toxicity. Why Q wave has a negative deflection in the ECG after MI? Because the dead tissue is negative compared to the normal tissue, so it produces a negative deflection on ECG. What is the effects of sodium, potassium and calcium in ECG? Low sodium produces low voltage ECG. Also, hypothyroidism produces low voltage ECG. These are the non-cardiac causes of low voltage ECG. The cardiac causes of low voltage ECG we did in the other video with constrictive pericarditis, cardiac tamponade and restrictive cardiomyopathy. The hyperkalemia produces tall peak T waves, but in severe hyperkalemia there is a tall peak T wave with wide QRS complexes. And in hyperkalemia, heart stops in diastole, whereas hypokalemia gives a flat or U wave, flat T wave or a U wave. Hypercalcemia, it increases the contractility and heart stops in systole. So in hyperkalemia, heart stops in diastole, and in hypercalcemia, heart stops in systole because it increases the contractility. What is the effects of sodium, potassium, magnesium and calcium on digoxin toxicity? Increase in potassium and magnesium decreases the digoxin toxicity, whereas increase in calcium increases the digoxin toxicity. What is the effect of ECG on the heart? Acidosis increases the diastole, but there is no change in the ECG. What is third heart sound? Third heart sound is because of the rapid ventricular filling, and the fourth heart sound is because of the high pressure in the left ventricle. It may be because of left ventricular hypertrophy, as in aortic stenosis, hypertension and cardiomyopathy. What is the effect of heart rate on the cardiac cycle? At a heart rate of 75, the normal duration for the cardiac cycle is 0.8 seconds and diastole is 0.53 seconds. But if the heart rate is increased to 200, then the cardiac cycle is reduced to 0.3 seconds and the diastole is there of 0.14 seconds only. Coming to the jugular veins, A wave is because of the atrial contraction. C wave is due to the tricuspid valve bulging into the atria. And the V wave is due to rise in atrial pressure before the tricuspid valves open.